Join us now, Dr. Mike Dow, as well as Dr. Sue Satcher. And thank you both for seeing Maya. And Dr. Satcher, I want to start with you. Medically, what did you find?
Fortunately for Maya, there were no electrolyte abnormalities, which sometimes can be seen in patients who constantly vomit and regurgitate food like this. There was no evidence of H. pylori, which is a bacteria which can also mimic some of these symptoms. And there was no gallstones, gallbladder sludge, which is a gallstones mixed in a blending machine, or any other abnormality found on her abdominal ultrasound. So it really does reinforce the diagnosis of rumination syndrome.
Which is something we're really glad to be talking about because, Dr. Dow, you say this is something that is often undiagnosed or underdiagnosed.
Yeah, that's right. It's really confusing, right? Because a lot of times you'll see these symptoms, the regurgitation, which is actually different from vomiting. It's actually more similar to like when we all burp after a meal, right? And it's an involuntary spasm. So a lot of times people will go to a GI, like this incredible GI, and again, there's nothing wrong, right? But then there's these symptoms. And a lot of times they will do some pH tests. They'll say, oh, well, nothing wrong. Sometimes they find something. Sometimes proton pump inhibitors to sort of neutralize the acid, but it doesn't treat the condition. And Maya, in your case, there was sort of this mind-body learning experience, right? So when you were in 6th grade and you got sick, and the first time the body learns it, it's sort of connected in the brain, right? So your body has learned a response, and then that learning, it never went away, right? And then it got worse and worse, and it was reinforced and reinforced. It's hard to diagnose because there's just not a lot of tests for it.
And this really kind of falls more into then the category of an eating disorder in terms of the psychological and the mind aspect of it, correct?
It can be, yeah. And sometimes people have bulimia and rumination syndrome, not in Maya's case. So Maya, in your case, this was just rumination syndrome. We used to see this in infants, right? Very young children who would grow out of it. We are seeing this being diagnosed more and more in adolescents and adults. And part of the reason for that, you know, my theory is it's stress. We are more stressed out. So even people who don't have an illness like you, sometimes adolescents who are wired for anxiety and untreated anxiety disorder, their bodies, all of the sympathetic nervous system, that fight or flight response that we get when we are anxious, when we're worrying too much, when we don't have enough stress reduction techniques that we use in our everyday life, it can actually cause these involuntary spasms. And so it's about stress.
But there is hope, and there is something that can be done. Maya, since you're here, I want to introduce you to someone. Buck Runyan is the executive director of Remuda Ranch at the Meadows.
Maya, at Remuda Ranch, we specialize in treating rumination disorder and women and girls with eating disorders. So in conversation with your team, we want to offer you free treatment at Remuda Ranch.
Sorry.
Never be sorry. Never be sorry.
What's going through your mind?
Okay, hang on. Going through this for so long, like, is so hard. Like, throwing up every time you eat is awful. Like, I would never wish this on anyone. And like, just, like, I don't even know, like, I'm so happy, like.
Do you feel hope now?
Yeah, like, like, there's so much I want to do. Like, I was telling, when they were, like, interviewing me and stuff, it's so ironic because what I want to do, what I want to go to college for, I want to go to culinary school. And so, like, of course I would get this in my life. So, just knowing that, like, I'm going to get past this is, oh my gosh, it's like life-changing, you know? Like, I can actually go do the things that I want to do and, you know, look forward and, like, be a teenager. Like, just go and do, like, normal things.
And just in time for your senior year, you know? So if you...
Maya, I think it's incredibly inspirational, your spirit, and the fact that you're also brave enough to share your story, because I'm sure there are people out there who have this, and it's not something we all recognize.
You're a rock star.
Thank you.
You've taught a lot of people a lot today about what you've been going through.